Good morning. This video is for the dentists preparing for any of the Gulf exams. It might be DHA, which is for Dubai, HAAD for Abu Dhabi, or OMSB for Muscat. I am Dr. Gauhar Fatima and I've completed my bachelor's in dental surgery from India. And let's have a look at today's questions. Okay. The first question, the gap between two solder parts should be. Now, soldering, as you know, is a process of joining pieces of metal using a filler material, which is known as the solder. So, the usual gap between two solders, the optimum gap they say is between 0.05 millimeters to 0.2 millimeters. So if you look at the options, 0.2 would be the most ideal answer. So the correct answer would be 0.2 millimeters. The second question, shade guide for cement during porcelain veneer restorations must we must use cement bases that is lighter than porcelain, because porcelain veneers are thin and the color from the underlying tooth may alter the final veneer shade. So we always use a cement base that is lighter than porcelain. Okay, you can have a look at the other options and then understand why this option is the best one, the one which is selected. Okay, the third question. In case of alveolar cleft with cleft palate, the area of the cleft is usually has a missing tooth congenitally. So let me talk about alveolar clefts. Alveolar clefts are the openings in the bone, usually of the upper jaw, that result from a developmental defect and which is present at birth. So the correct answer would be congenitally missing tooth in that area. In the next one, in case of class 5 provisional restoration, which factor is important for locking? Which one do you think? I feel it is undercut, because undercuts help in locking the restoration in the tooth. So the next question I'm not very sure about. Please go through it and find out if the answer is right. I felt that 1 month would be the right answer. The sixth one, what is the type of wax used to verify the occlusal reduction for full veneer restorations? It's the utility wax. Utility wax is the red thin paper like wax, which is usually, it is workable and it is adaptable also at normal room temperature. So that's the type of wax used once the occlusal reduction is done and to verify it. Okay, the next question would be, the cone beam radiograph is mostly used for find the diagnosis for TMJ disorders. So as you can see in the picture, that is the cone beam radiograph, and the best answer would be the option D. The action of Hawley's appliance is mainly tipping. This you would have learnt in ortho, and it's quite a direct question. Hawley's appliance is quite a popular removable appliance used for minor tooth movements to achieve them, and tipping is mainly the action of Hawley's appliance. Next question is again an ortho question. A light force applied to the periodontal ligament during orthodontic treatment is considered continuous. It has to be continuous because continuous and light um, forces never brings the movement to zero. But if the movement is interrupted or indirect or intermittent, uh, it can decline to zero, the effect of the force. And usually the force has to be continuous and light. So the word we are looking for is continuous here. The 10th one, this is quite an easy question. The fluoride concentration in most dentifrices range from. Usually it's around 1000 ppm. So 900 to 1500 ppm would be the ideal answer. So we choose that. Okay, here are the 10 questions for today. Tomorrow I will upload 10 more questions with some reasoning. This is just for your to help you people, and if you have any suggestions or you think I can change anything in the videos, any changes you would like, please let me know in the comment section. Also subscribe so that you know when the next video is uploaded, and you'll have continuous flow of questions almost every day. And you once 2 months is up, you'll almost be ready to give the exam. Yeah, thank you.